A big step today toward helping Minnesotans deal with medical debt. Just hours ago, Governor Walz signed the Minnesota Debt Fairness Act. That law will bar providers from transferring a dead patient's debt to a surviving spouse. It also outlaws providers from stopping care because of unpaid medical bills. John Croman's here with the details.
The bill Governor Walz signed won't erase medical debt, but it will help patients stay afloat financially while they're trying to pay it back.
If you contract the debt fairly, you should pay it back. We all agree on that. But we also agree that our debt payment systems shouldn't make it harder to pay you back, and they definitely shouldn't make you poorer and run into financial ruin as you try to pay back.
The legislation bars health providers from denying medically necessary care because of debt. It bars them from reporting medical debt to credit bureaus. It prohibits providers from automatically transferring medical debt to a spouse after a patient dies, which is what happened to Walt Myers, what he faced when his wife Sue died of cancer in 2019.
Those EOBs turned to actual bills that eventually totaled over $135,000. I panicked, not knowing how I could ever pay that out of pocket. I mean, who has that kind of money?
A legal aid nonprofit known as Cancer Legal Care helped him resolve the situation, but he worried about others in the same boat.
Without that social worker's advice, I still might be making monthly payments on a six-figure medical debt that I actually didn't owe.
The legislation also sets new limits on how much of a person's paycheck can be garnished to pay off medical debt and consumer debt. It will now range from 10 to 25% instead of the flat 25% under current law.
This piece of good consumer news is not being welcomed by the hospital industry. The Minnesota Hospital Association said it will only lead to more uncollectible bad debt at a time when hospitals are in fragile situations financially. At the Capitol, John Croman, KARE 11 News.